Hello. In this episode of Psychiatry in 5 Minutes, we're going to cover delirium. Now, delirium is best thought of as acute brain failure. That is, acutely, your brain is not able to do what it could before. Now, most of the time, people who are delirious lie there sleepily, not totally aware of what's going on. But about a quarter to a third of the time, they're agitated, striking out, hitting people. And those are the people you get consulted on. So the question is, what can cause brain failure acutely? And it's usually a couple things. Infection, sepsis can certainly cause that. In addition, medications can make you sleepy or groggy. So beware, especially sedating medications such as narcotic pain relievers, benzodiazepines, but also anticholinergic drugs are famous for making people confused. If your labs are off, in addition, that can make you confused. That is, if your sugar is way off, if you have a urinary tract infection, if your electrolytes, or if you're anemic, all those things could cause it. Now, sometimes there's one cause that is to blame, but more often there's a couple of things that come together and all added up make somebody delirious. Now, because delirium is acute brain failure, those who have chronic brain failure, that is dementia, are more likely to get it. And in fact, in the hospital, a lot of people who have delirium also have an underlying dementing illness that may or may not have been identified. So what do you do when you're asked to see somebody with delirium? First of all, you check the history. When did this begin? What sort of time frame are we talking about? Is it immediately after surgery? Remember, post-op delirium day 3, post-op day 3 is usually alcohol withdrawal delirium, no matter who it is. You should then evaluate what medications they're on, try to remove all the anticholinergic and sedating meds you can. Look for infection. What are the vital signs? Do a urinalysis, check a chest x-ray, and check labs, CBC lights, BUN, creatinine, liver function tests if they're off. Remember that ammonia can sometimes be elevated even if you have normal liver function tests. Check an EKG. Occasionally, a myocardial infarction will present with confusion, and check an O2 saturation because, again, low oxygen levels can also cause it. It's also a good idea to do some type of cognitive screen, MoCA or mini-mental or slums. Remember that because delirium by definition has a waxing and waning course, the lab tests, that is MoCA or mini-mental, can also vary in terms of their score. So brain failure is not good. If you have delirium, it's a poor prognostic sign. The 1-year mortality rate of those who have delirium is about 1/3 to 40%. So, in other words, if your brain is not able to cope with insults, it's not a good sign that you're doing well either. So what do you do for treatment? First of all, find the etiology if you can. Again, most of the time, there's a couple of things. Correct what you can. In other words, make sure their sugar is okay. If they have a urinary tract infection, treat that with an antibiotic, and treat what you can. Next, manage the patient's safety. Manage the environment. Does the patient have their hearing aids in? Do they have their glasses on? Remember, you need to prevent hypoxemia. What's the O2 sat? If, despite all of that, they remain agitated, then you have to treat with medication. Usually the pills that are used are quetiapine or olanzapine. Remember, though, that those with dementia have an increased risk of death with the use of antipsychotics. So it's a good idea to get permission from the family before you use that. Also wonder about pain. Because they're confused, they may not be able to complain of pain, so think about pain relief. Now, finally, as we talked about, delirium is a common problem and, is often associated with poor outcomes. So it would be good to prevent it if we can. We haven't found a way to do that yet, but a couple of studies have shown that the use of Ramelteon, that is a melatonin agonist sleeping agent, has been associated with decreased risk of delirium. So it's worthwhile thinking about. There's lots more to learn. Read more about delirium. Thank you.